Right. This is Pack 65. Myself, Srija. Today, in this session, you're going to learn about the introduction to surgery respiratory system within the CPT coding. So, how the codes are classified within the surgery respiratory system section, and what are the procedure terminology used in the CPT coding. So, you're going to learn about these details in detail. So, respiratory system. This CPT section includes surgical and diagnostic procedures performed on the respiratory system, which covers nose, sinuses, pharynx, larynx, trachea, bronchi, and lungs. So, the codes are arranged by anatomical site first, then by type of the procedure. So, what are the important things from this slide? Headings and subheadings. So, CPT work is divided into main headings, for example, nose. So, under each heading, there are subsections like incision, excision, repair, etc. So, some subsections have a asterisk symbol, meaning they contain special coding rules. You must read the guidelines before coding. So, you have to always read the notes and guidelines before selecting a CPT code. And second is special notes and guidelines. So guidelines appear before the list of procedures. They apply only to that subsection. So they may tell you what is included, what is not separately billable, when to use modifiers. So questions often test whether you noticed a guideline that changes the code selection. Code order may look confusing. So codes are listed as they appear in the subsection. So they may seem out of the numerical order. So some codes may appear again in another subsection. So this is very normal in CPT. You have to follow anatomy plus procedure, but not just in the numbers. So coming to how the subsections of respiratory system are divided. So the first subsection is nose. The code ranges are 30,000 to 30,999. So what are the anatomical structures which are used in nose? External nose, nasal cavity, septum and turbinate. So the first section is incision. The code ranges are from 30,000 to 30,020. So these codes involve cutting into the nose but not removing the tissue. For example, incision and drainage of the nasal abscess, drainage of the hematoma. So these are used mainly for infection or pressure relief. Second subsection is excision. So excision, the code ranges are 30,100 to 30,160. So these involve the removal of tissue. For example, nasal polyp removal, turbinate excision. And third is introduction. The code ranges are 30,200 to 30,220. So introduction codes, these are used for placing something into the nose. For example, nasal packing and control of epistaxis. So fourth is removal of the foreign body. 30,300 to 30,320 are the code ranges. So removal of foreign body codes, these are used when an object is stuck inside the nose, and removal may be a simple or complex repair, or removal of the foreign body would be a simple way or a complex way. So coding always depends upon the patient age and also method used. So methods like instrumentation or anesthesia. And the fifth subsection is repair. The code ranges are from 30,400 to 30,630. So repair, these are the reconstructive procedures, for example, septoplasty and rhinoplasty and also nasal fracture repair. So next procedure is destruction. The code ranges are from 30,801 to 30,802. So destruction codes, these codes mean destroying the tissue without cutting it out. So methods include cautery, cryotherapy, chemical agents. So common use is a turbinate hypertrophy. And other procedures are 30,901 to 30,999. So these are used when a procedure does not fit into incision, excision, repair, etc. So they are often miscellaneous or uncommon nasal procedures. So you have to always check if a more specific code exists before choosing the other procedures. Axillary sinus. The code ranges are 31,000 to 31,299. So these are the paranasal sinuses. They include maxillary sinus, frontal sinus, ethmoid sinus, and sphenoid sinus. So these are mainly used commonly for sinusitis, polyps, tumors, and drainage procedures. And here also we do have incision, excision, endoscopy, and other procedures. So in incision, opening the sinus to drain the pus, to relieve the pressure and treat the infection. For example, maxillary sinus puncture and lavage. And coming to excision, removal of the sinus tissue, polyps and diseased mucosa. So this is often done during the functional sinus surgery. Endoscopy means it uses an endoscope to visualize or the treat sinuses. So this asterisk means a special guidelines apply and bundling rules are very important in this endoscopy procedures. For example, diagnostic sinus endoscopy and endoscopic sinus surgery. Other procedures, these are the rare or unlisted sinus procedures. So next section is larynx. The code ranges are from 31,300 to 31,599. So larynx is the voice box. So functions of larynx are voice production, airway protection as well as breathing. So the excision is a subsection, introduction, endoscopy, repair and other procedures. So excision involves the removal of the vocal cord lesions, nodules as well as tumors. So this can be both an open approach and also the endoscopic approach. Whereas introduction, placing something into the larynx. For example, endotracheal intubation. So many introduction codes are emergency or airway related. And endoscopic codes. So they use laryngoscopy using an endoscope. This may be a diagnostic procedure or a surgical procedure. And repair. So fixing damage due to trauma, stenosis and also the structural defects. For example, laryngeal fracture repair. And other procedures 31,599. These includes unlisted laryngeal procedures. They also require the documentation and the payer review. Here is a picture. You can see trachea, bronchus, bronchioles, lungs, ribs and diaphragm. And next section is trachea and bronchi. So trachea means a windpipe and bronchi, these are the main airways which are located inside the lungs. So the code ranges are from 31,600 to 31,899. So incision, it involves the surgical opening of the trachea or bronchus. So examples like tracheostomy or tracheal incision for airway access. And second is endoscopy. So endoscopy in bronchi, it uses the bronchoscopy, which is the most common, which are used for visualization, biopsy, removal of the secretions as well as the treatment. And bronchial thermoplasty. So this is the advanced procedure for severe asthma. So bronchial thermoplasty, it uses the radio frequency energy to reduce the airway smooth muscle. So these are done in multiple sessions and this is not a routine bronchoscopy. And introduction, the placement of something into trachea or bronchi. Examples include endotracheal tube as well as the stent placement. And next is excision and repair. So this involves the removal of the tumor, scar tissue and repair of the tracheal injuries and bronchial damage. So these are often open procedures but not the endoscopic procedures. And other procedures, these are the unlisted procedures which require strong documentation. And the next section is lungs and pleura. So the code ranges are 32,035 to 32,399. So pleura it's a double membrane layer which is covering the lungs. And lungs we have upper lobe, middle lobes and lower lobes. So these have the extensive guidelines. So bundling and approach are very crucial in lungs and pleura section. So coming to subsections, we have incision, excision or resection, removal, introduction and removal, and as well as the destruction. So incision, it involves opening of the chest or lung, for example, thoracotomy or chest tube incision. Excision or resection, it involves the removal of lung tissue, for example, wedge resection, lobectomy or pneumonectomy. So the amount of lung removed determines the code here. Right versus left lung also matters more. So in the removal, it includes removal of the foreign bodies, lesions and fluid collections. For example, removal of the pleural mass. Introduction and removal. So placement and removal of the devices, for example, chest tubes and pleural catheters. So many are bundled into the larger procedures. And next subsection is destruction, 32,560 to 562. So destruction involves destroying the tissue within the lung and pleural layers. So the methods used are chemical, thermal. For example, pleurodesis is used to prevent the recurrent pleural effusion. And here you can see the picture of the lungs. So the right lung has 3 lobes and the left lung has 2 lobes. There is a primary bronchi location and also you can find the trachea location in this picture. So next subsection is thoracoscopy, video assisted thoracic surgery. Nothing but a surgery called as VATS. So it's a minimally invasive lung surgery using a camera and a small incisions. So VATS is mostly used for the lung biopsies, wedge resection, lobectomy, and pleural procedures. So VATS is not an open thoracotomy. The approach is open versus thoracoscopic changes the code. So multiple procedures in one session is the primary procedure rules apply. And next subsection is stereotactic radiation therapy. What it is? It's a highly focused radiation therapy. So this uses mainly for lung tumors in patients who are not surgical candidates. So key point is this is not a surgery. It's an extremely precise and high dose radiation. So these are often confused with oncology codes. So location always matters within the stereotactic radiation therapy. And the code is 32701. And next repair codes, they include repair of the lung or pleural damage which are caused by trauma, disease and surgical complication. So examples of repair is repair of bronchopleural fistula and repair of the lung tear. Lung transplantation codes 32,850 to 32,856. So what does it include? Removal of the diseased lung and implantation of the donor lung. So types, it also includes the types. Single lung transplant, whereas it also has a double lung transplant. And the next subsection is surgical collapse therapy, thoracoplasty. So what it is? Surgical collapse of part of the lung, which is historically used for tuberculosis. So how it works? It works by the removal of ribs to collapse the lung tissue. And the other procedures, they include the unlisted or unusual respiratory procedures which require operating report and comparison to similar CPT codes. So these are the sections and subsections of the surgery respiratory system section. So next is what are the basic procedure terminology used within the respiratory system. So these are the foundation concepts every coder must know. So the first is bronchoscopy. A CPT code range is 31662 and 31651. So what is bronchoscopy? It's an endoscopic examination of trachea, bronchi and airways. So it is commonly used for diagnosis, biopsy and also removal of the mucus or foreign body. So what are the very important coding guidelines for bronchoscopy? Diagnostic bronchoscopy may be bundled and surgical bronchoscopy usually separately billable. And the second terminology is thoracocentesis. So CPT codes are 32554 to 32557. So thoracocentesis is it's a needle removal of fluid from the pleural space. So this is used for the pleural effusion, diagnostic sampling, relief of the breathlessness. So coding always depends upon the imaging guidance, amount of the fluid and diagnostic versus therapeutic. And the third is pulmonary function test. CPT code range is 94,010 to 94,799. So what they measure? What does this pulmonary function test measure? It measures the lung capacity, airflow and also the gases exchange taking in the lungs. So examples like spirometry, lung volume testing. They also measure the lung capacity and also the airflow. So the common conditions diagnosed with pulmonary function test is asthma, COPD, restrictive lung disease. And these are not surgical. So it's founded in the medicine section but not the respiratory surgery. And multiple pulmonary function tests may also be bundled. And the fourth procedure is tracheostomy. The CPT code range is 31600 to 610. And tracheostomy, it's a surgical opening in the trachea to help the patient to breathe. So when it's used in the airway obstruction, during the long-term ventilator support and also during the trauma or a head neck cancer. So there are types of this tracheostomy. There is a temporary tracheostomy and permanent tracheostomy. And this matters more in emergency versus planned. So these are separate from the endotracheal intubation. They are located under the trachea and bronchi. So do not confuse tracheostomy with intubation. Fifth procedure is pleural biopsy. So what does pleural biopsy is? It's a removal of pleural tissue, that is a lining of the lung for diagnosis. So this is mainly used to detect the tuberculosis, cancer and chronic infections. So the methods which are used in pleural biopsy is needle biopsy, open biopsy and thoracoscopic biopsy. So lung tissue is, it's a lung biopsy. Lung lining means pleural biopsy. And next is lung biopsy. CPT code 32405 to 674. And Lung biopsy, it is used for removal of the lung tissue to examine under a microscope. So what are the indications for taking the lung biopsy? Maybe patient is suffering from the lung cancer, interstitial lung disease, or from any of the infections. So the lung biopsy is of many types. It may be a needle biopsy, it may be an open biopsy, and also the VATS biopsy. So in this lung biopsy, always matters is the approach. What kind of approach it is, whether it's an open approach or a thoracoscopic approach. So this may be bundled into larger lung surgeries. And the seventh procedure is endobronchial ultrasound, EBUS. So what it is, it's a combination of bronchoscopy plus ultrasound. So this is mainly used for examining the lymph nodes, lung cancer staging, and also guiding the biopsies. So why it's important? Because it is a minimally invasive. So very common in oncology cases. So this is more advanced than any standard bronchoscopy. And this endobronchial ultrasound, it often includes the lymph node sampling. And the eighth procedure is thoracotomy. The CPT code ranges are from 32,100 to 32,160. So what is thoracotomy? It's a large surgical incision into the chest wall to access the lungs, pleura, heart, or mediastinum. So why it's done? Because it's a tumor removal. It is used in major lung surgery and also it is used for the trauma. So thoracotomy, it's an approach. It is not a treatment. So it is a method of the access, and other procedures like lobectomy, pneumonectomy are often performed through a thoracotomy. So do not quote thoracotomy separately if it is a part of more definitive lung procedure. And ninth is lobectomy. The CPT code ranges are from 32,480 to 486. So what is this lobectomy mean? It's a surgical removal of one lobe of the lung. So right lung has 3 lobes, left lung has 2 lobes. So removal of any one of the lobe or multiple lobes come under section is lobectomy. So indications, what are the indications of lobectomy is for, it's a common procedure treating the lung cancer, severe infection and localized disease. So this is more extensive than the segmectomy, and also this is less extensive than the pneumonectomy. Here in taking the lobectomy process, in performing the lobectomy process, the laterality, nothing but the right side or left side lobes matters more. And the next is pneumonectomy. So what is pneumonectomy? It's a complete removal of one lung. So when it is done, when there is an advanced lung cancer or when there is a disease involving multiple lobes. So pneumonectomy, this is a very high risk procedure. This is a major surgery and the documentation must be very clear for assigning pneumonectomy codes. And CPT code ranges are from 32,440 to 445. And the 11th procedure is segmectomy. So segmectomy, it's a removal of specific segment of a lung lobe. So why it's done? Because of the early stage lung cancer and also to sometimes to preserve the lung function. So segmectomy is always a lesser procedure than lobectomy, and lobectomy is always a lesser procedure than the pneumonectomy. So this is a lung sparing surgery. And next procedure is decortication of lung. So what do you mean by decortication of the lung? So it's a removal of fibrous tissue from the lung surface, nothing but the pleura membrane, to allow the lung to expand. So when it's needed, because during the chronic pleural infections, during the empyema and also the trapped lung syndrome. So what is removed in this decortication of lung procedure? Removal of the fibrous pleural layer. So there is no lung tissue removed. There is only the fibrous pleural layer removed. So decortication is nothing but it's a freeing of the lung but not removing of the lung. Next procedure is pleurodesis. So pleurodesis, it's a procedure where the pleural layers are intentionally stuck together to prevent the repeated fluid or the air collection. So how it works? It's a chemical or mechanical irritation used. So this causes inflammation which results in scarring, which results in the pleura adhesion. So why it's done? Because for recurrent pleural effusion or for recurrent pneumothorax, whenever this recurrent pleural effusion and pneumothorax are diagnosed, so pleurodesis is performed. So pleurodesis, it's a prevention, but it is not a drainage. So this is often performed after the chest tube placement And do not confuse fluorodesis with the thoracocentesis. And mediastinoscopy. CPT code is 39401. So what is a mediastinoscopy? It's an endoscopic examination of the mediastinum, the space between the lungs. So what are the structures evaluated in this procedure? The mediastinal lymph nodes, trachea and esophagus. So what is the main purpose of this scopy? For lung cancer staging and for lymph node biopsy. So mediastinoscopy, it's a diagnostic but not a therapeutic procedure. And chest tube placement. So insertion of a tube into a pleural space to remove the air, blood and fluid. This is called as a chest tube placement. So why this process is done? So this procedure helps to treat the pneumothorax, pleural effusion and as well as the hemothorax. So the tube which used in the chest tube placement, so the tube restores the negative pressure, allowing the lung to re-expand. So emergency placement is very common here, and this is often bundled with the trauma care. And next procedure is a diaphragm plication. So diaphragm plication, it's a procedure of the surgical tightening of the weak or paralyzed diaphragm. So whenever the diaphragm is paralyzed or weakened, when it is paralyzed, so the surgical tightening of this paralyzed or weakened diaphragm is called as the diaphragm plication. So why it's needed? For diaphragmatic paralysis and also for eventration of the diaphragm. So what are the outcomes for diaphragm plication? To improve the lung expansion, to reduce the shortness of the breath. So nothing is removed in this, only the diaphragm is reshaped. So this is not a hernia repair. And next procedure is laryngoscopy. So what it is, a laryngoscopy, it's a direct or indirect examination of the larynx. Nothing but a voice box. So why it's done? Because of the hoarseness, because of the vocal cord paralysis or dysfunction, because of the polyps or tumors found in the larynx. So what are the types? We have indirect type and direct type. So indirect type are divided into mirror and flexible scope, whereas direct type, it is divided into rigid scope, often under the anesthesia. So do not confuse this with a bronchoscopy, a lower airway procedure. This is the upper airway procedure and that is the lower airway procedure. And next procedure, excision of the laryngeal tumor. So CPT code ranges are from 31541 to 31546. What it is? So it's a surgical removal of the abnormal growth from the larynx, which is a voice box. So why it's done? Because of its laryngeal cancer. Because of this, it is a benign tumor, polyp and nodules, and also due to a severe airway obstruction. So how it's performed? Usually via the direct laryngoscopy. So many may use laser or microsurgical instruments. So this is not a therapeutic procedure. It is not just a diagnostic. This is a therapeutic procedure. And size, depth and approach may affect the CPT selection code. So biopsy alone is not the excision. You have to include all the descriptions in the CPT code. And also next procedure is vocal cord injection. So CPT code ranges are from 31570 to 31579. So what it is, it's an injection of material into vocal cords to improve the voice quality. And what are the materials injected? It may be a collagen, fat, hyaluronic acid and calcium hydroxypeptide. So what are the indications? Vocal cord paralysis, vocal cord atrophy and glottic insufficiency. So these are the indications for performing the vocal cord injection. So this injection, it bulks up the vocal cord so it can be closed properly. Next is submucous resection of the turbinates. So what is a submucous resection? So it's a removal of the turbinate bone beneath the mucosa which is preserving the lining. So why it's done? Because of the chronic nasal obstruction and also the inferior turbinate hypertrophy. So mucosa is always preserved here, which leads to less bleeding and faster healing. So submucous means always the under the mucosa. So you should not confuse with this with the turbinectomy. Turbinectomy, it's a complete removal. Whereas submucous resection of the turbinates, it's a removal of the turbinate bone which are beneath the mucosa. And the code is 30,140. Next is rhinoplasty. CPT code range is 30,400 to 450. So what is rhinoplasty? It's a surgical reconstruction or a reshaping of a nose. So what are the reasons and what are the indications which are diagnosed for using the rhinoplasty. So it may be a cosmetic reasons for sometimes, maybe a deviated nasal septum, post-traumatic deformity, and also due to a breathing difficulty. So there are types of rhinoplasty: cosmetic rhinoplasty, functional rhinoplasty, and reconstructive rhinoplasty. So insurance usually covers functional but not the cosmetic procedures. So documentation must support the medical necessity, and the cosmetic only cases may be not covered. And next procedure, rhinotomy. So CPT code ranges are from 30,000 to 30,020. So what is a rhinotomy? Otomy means it's a surgical incision. So rhinotomy is a surgical incision onto a nose to access a deeper structures. So why it's done? Why it's performed? Because of for tumor removal, for severe fractures, or whenever there is a deep nasal pathology, we can use this rhinotomy procedure. Nasal endoscopy with biopsy. So CPT code range is 31,237. So what is a nasal endoscopy with biopsy? So a doctor inserts a thin camera, nothing but a endoscope, into the nose to look inside the nasal cavity, and he removes a small tissue sample, that is a biopsy, for testing. So why it is done? For chronic sinusitis which is not responding to the treatment, suspicion of the tuber, polyp, or the abnormal growth, and also the unexplained nasal bleeding. So here are the key teaching points: endoscopy plus biopsy. You can quote the CPT code 31237. So biopsy means a tissue is taken and sent to pathology. So this is done under the local or general anesthesia. So do not code separately for biopsy. So biopsy is included in the CPT code 31237. And next procedure is sinusotomy. So what is sinusotomy? It's a CPT code ranges are from 31,000 to 31,090. So it's a surgical opening of one or more sinuses to improve the drainage and remove the infection or blockage. So why it is done? For recurrent sinus infections, for blocked sinus drainage, for sinus abscess. So the examples are maxillary sinusotomy, frontal sinusotomy, ethmoid sinusotomy. So this is a surgery. It is not an examination. So sinusotomy, it helps to restore the normal sinus airflow and the drainage. So codes depend on which sinus is treated. And multiple sinuses, if you have multiple sinuses in the patient record, so you have to assign the multiple codes. So next procedure is nasopharyngoscopy. So nasopharyngoscopy is done using an endoscope to examine the nasopharynx. So nasopharynx, it's an area behind the nasal cavity and above the throat. So why it is done? Because there may be a nasal obstruction, enlarged adenoids, voice problems, and throat or airway abnormalities. So this is a diagnostic procedure only. There is no biopsy, no surgery done in this procedure. So this is very common in ENT clinics. And CPT code 92,511, it's a visual examination only. So if biopsy is done, you have to use a different CPT code. And next procedure is flexible bronchoscopy with lavage. And CPT code is 31,624. So what it is? It's a flexible tube. So in this procedure, a flexible tube is passed into the lungs and saline is washed into the bronchi and suctioned out to collect the samples. So why it is done? Because of the lung infections, to detect the lung infection, to detect the tuberculosis, pneumonia, and lung cancer evaluation. So here the lavage word indicates washing. So sample sent for culture, cytology, or lab test. This is a diagnostic procedure, but it is not a therapeutic procedure. So CPT code 31,624, it includes the bronchoscopy, lavage, but do not code lavage separately whenever you see this procedure. Tracheoplasty. So tracheoplasty code ranges are 31,750 to 760. So what is a tracheoplasty? It's a surgical repair or a reconstruction of trachea. So what is trachea called otherwise? Windpipe. So why it is done? For tracheal narrowing, for stenosis, if there are any birth defects, if there is an injury or tumor, if there is a post-intubation damage. So you have to use this tracheoplasty procedure. This is a major reconstructive surgery. So it improves the airflow and breathing. It is performed in advanced surgical settings. So in these cases, the code selection always depends upon the type of repair and the length of the trachea involved. So often requires operative report review. Next procedure is esophageal dilation with bronchoscopy. So CPT code is 43,220. So this is a procedure to widen a narrowed esophagus using a special dilators. So it is often done during the bronchoscopy when airway evaluation is also not needed. So why the esophagus becomes narrow? Because of the esophageal strictures and acid reflux damage, scarring after the surgery or radiation, and also the presence of tumors. So why bronchoscopy may be done together? To access the airway compression, to protect the airway during the dilation. So this is very common in the complex chest or mediastinal conditions. Next procedure is thoracoscopic lung biopsy. So what is a thoracoscopic lung biopsy? What happens in this procedure? So this is a minimally invasive lung procedure which is performed using a thoracoscope. So thoracoscope is nothing but it's a camera inserted through the small chest incisions. So why it is done? Because it is often performed to diagnose the lung nodules for interstitial lung diseases, suspected lung cancers, and unclear lung infections. So there are types of the biopsies, single lobe biopsy and multiple lung biopsies. So tissue is removed for pathology in this procedure. There will be a less pain and it's a faster recovery than the open surgery. And this thoracoscopic lung biopsy, it always requires a general anesthesia. And the last procedure is video assisted thoracoscopic surgery, VATS. So VATS, the code ranges for VATS is CPT 32,650 to 674. So what is VATS? It's a video guided minimally invasive chest surgery which is used to treat the lung and pleural diseases. So what can be done with VATS? It can diagnose lung biopsy, pleural effusion drainage, lung wedge resection, lobectomy for lung cancer, and also pleurodesis. So why VATS is preferred? Because of the smaller incisions. It also has less pain. So it gives faster recovery and it also has a lower complication rate. So this is always why it is preferred more. So VATS is a surgical approach but not one procedure. So multiple CPT codes depending upon the type of surgery, lung versus pleura and extent of the resection are assigned in these cases. So you have to choose CPT based upon what was done but not just VATS. So always read the operative report before assigning the VATS procedure code. So these are the procedures terminology used in the CPT surgery section respiratory system. So this is for today's session. I hope this session has helped you. In the next session, you're going to learn about how are the codes classified within the respiratory system section and what are the CPT coding guidelines which are used for assigning the codes very accurately. Thank you.